Hey everybody, today I wanted to talk to you about Feverfew. I don't know if you've ever heard of this plant. My mom used to use it years ago. She had broken her neck, and so she used it for pain, and she used it for a long time. But that's not really what its history was for. It has kind of an interesting history. This is a member of the daisy family, and it's been used mostly to treat headaches, but it also has treated arthritis and problems with labor and childbirth. Ancient Greek physicians used it to reduce inflammation and treat menstrual cramps. It was used for fevers, but as the name suggests, it wasn't super effective for that. In Great Britain, they did a study of people who have migraines. And so the study was about 250 to 270 people. And they found that 70% of them felt much better after taking an average of 2 to 3 fresh feverfew leaves daily. And several studies I believe also in the US have looked at feverfew. Some of the studies are inconclusive. Other studies said that people did feel better. People who have chronic migraines seem to do really well when they combine feverfew with white willow, which has chemicals like aspirin. So when they took them together in a combination twice a day for 12 weeks, they had fewer migraines and the pain didn't last as long or hurt as much. So that's a real good benefit of this plant. Another study found people who took a special extract of feverfew had fewer migraine attacks per month compared to people who took a placebo. And a 3-month study found people who took a combination of feverfew, magnesium, and vitamin B2 led to 50% decrease in migraines. There's benefits in other areas as well. There's an anti-cancer effect. So there are studies in test tubes that show that compounds in feverfew may inhibit certain cancer cells. Of course, I talked a little bit about the pain relief. There's an anti-inflammatory properties of feverfew that may help relieve pain. And it also helps irritated skin. So there's topical creams with feverfew in it can help. Like if you have dermatitis, it can help with that. Rosacea, topical creams containing the parthenolide free feverfew may help treat acne, rosacea by reducing the inflammation. So what they do is they extract the parthenolide, which can irritate skin. They'll extract that and then use the rest of the compound for the creams. And it did show in some studies elevated mood. So that's helpful. But there are some side effects. It's generally considered safe with few reported side effects, but it can cause stomach aches, heartburn, diarrhea, constipation, dizziness, tiredness. So if you're sensitive to this plant, you should also avoid handling it because of the parthenolides in the leaves can irritate people who are sensitive to these plants. Like if you are allergic to ragweed or plant families like that, daisies, marigolds, chrysanthemums, you should avoid this plant and you shouldn't take this. Always consult your doctor. This plant, this can interact with certain drugs like blood thinners and medications that are broken down in the liver. So you also do not want to give it to any children under 2. And if you're pregnant or lactating, you should not take this plant at all. There certainly needs to be more studies, but it has been used for centuries. Always do your homework, do your research, and always talk to your doctor before you can take any herbal supplements. But this one has been used for a long time. So if you're a chronic migraine, suffer, I would suggest maybe talking to your doctor. Maybe it can be beneficial for you, especially maybe if you combine it. If you're a person who really doesn't like to take like Western medications and you want to combine it with white willow and have that like synergistic effect between the two, maybe it'll help you. But again, talk to your doctor. Let's make sure that it doesn't interfere with anything, any medications or anything else going on in your body. But try it. If your doctor says it's okay to take, then try it and see what happens. It could be beneficial for you. I hope that you found this episode helpful. Thanks as always.